Hello, everybody. Welcome to our training. My name is Laura Packard, and I'm a healthcare activist. 3 years ago, my personal and political became pretty much gone. I walked into a doctor's office with a nagging cough and found out a stage 4 cancer diagnosis. The day after my first chemotherapy appointment, the U.S. House voted to dismantle the Affordable Care Act, which was keeping me alive. So I interspersed doctor's appointments with rallies, begging the U.S. Senator to vote to keep our care. That didn't exactly work out because in September that year, my senator joined others to introduce yet another repeal bill. And shortly after that, President Trump blocked me on Twitter while pushing that same bill. In December that year, I finally got the chance to meet my senator face to face and ask him about his votes, but I was thrown out of his public event for trying. It shouldn't have to be like this. But one thing I've learned is that our stories make a difference. We stopped repeal in 2017, and many of the people responsible are no longer in office today. In 2018, I started this nonprofit, Healthcare Voices, to help people tell their own stories. Next year, I'm hopeful we'll finally be able to move forward with laws that help people as opposed to fighting so hard just to keep what we've got. But we know it won't be easy. Getting the ACA passed in 2009 was very, very hard, and passing anything next year will be even harder. We'll need all of you with us. So today we'll talk about how to do just that, how to tell your personal story in the most effective way. And with that, I'm turning it over to Vicky Rausch and Arshad Hassan.
Thank you, Laura.
Hi, Laura. Thank you.
Well, we're excited to be here with you because it really is truly powerful. The stories that we all have, the experiences, the lives we've lived. It's a way for us to connect with other people. And what I think we sometimes underestimate is the power of our own personal stories to change the world. I'm not being hyperbolic. I really mean it. It changes minds. It can change policy, and it can change the people in power. So let's get started with what we're going to do is a little training for you on how to tell your story in a way that will persuade people. All right. So again, welcome. Thank you for coming. Well, let's start with a little bit about ourselves. Vicky, would you like to start us off?
I sure would, Arshad. I'm so happy to be here with everyone today. It's very exciting to be part of this event tonight that Laura's put together. My name is Vicky Rausch. I'm Arshad's partner in Convey Communications. And, you know, I was that kid. I was that kid that whenever the curtain went down on the show, I was still out front. I was still singing and dancing and smiling and carrying on and being that precocious youngin'. And there was something I discovered. There was nothing I loved more than performing. Nothing gave me more pure joy. I became a theater kid, a drama geek through my whole life, all the way through school, through college, and even up until now. The studying never stops, and I love it. There's nothing more I love than being on a stage. And there's something I noticed a few years ago, and that is movement people, when they would tell their stories or they would appear on TV or in front of a group, they never really connected with the audience. Often they'd just read in a monotone way or in a dispassionate way. And it was very unnerving to me because I wanted to see a performance. I wanted to see people connect like actors do with how they use their words. That's how they connect. And that is what I bring to this situation is I want you to be the best performer that you can possibly be. I want you to be that drama kid. I want the light to shine on you and for you to be noticed.
Thanks, Vicky. And I come from this from a little bit of a different perspective. Some time ago, I might have been that that movement person who just didn't connect. Well, I got my start early, and I ended up running a major organization where one of our big issues was healthcare reform. I ran an organization called Democracy for America, and I got up there really early. I wasn't even 27 when I took over a national organization, and I thought, well, okay, yay! This is because I'm good at this. I'm good at program work. I'm a good fundraiser, and I've got important things to say and do. So yeah, okay. So I'm the leader of this organization now. But I ran into some pretty significant problems right off the bat. I just didn't think that people were taking me seriously enough. And sure, it was young because I was young and I was a person of color. And how would you take somebody like that seriously? One time I was backstage. It's a long time ago, 2007. You might remember that we had a presidential primary back then with a bunch of different Democratic candidates. And I was backstage with all those different Democratic candidates, their spouses, some of the top staff. How cool was this opportunity? I could tell them about my organization. They knew about the organization. And I could, I could say, yeah, okay, great, engage us. So I went to candidate after candidate, introduced myself. And I went up to one of the candidates, one of them who was actually engaging us. And I waited patiently for him to be done with the person he was talking to, him and his wife. And I waited and I waited. And finally I thought, well, okay, maybe it's my turn. And they both turned around and they handed me their trash to throw away. And then they turned right back around to continue their conversation. I was devastated. This was the realization that I came to. As a young leader, somebody who has important things to say, I needed to have a stronger presence. I needed to take up space. I needed to be able to tell my story in a way that cut through clearly, that turned heads. So from that point on, I started taking every opportunity I could to speak and to tell my story. And those stories, and not just my story, but other people's stories, to lift them up, because that is what makes a huge difference in this world. You can read off all the facts and numbers and statistics that you want, but unless our leaders are ready to share their stories, we're not going to connect with the people who need to hear them, with the people who have the potential to change the world. So that's why we're going to spend the next bit of time with you talking about how to tell your authentic story and how to do it to cut across. We both refer to this problem where we have heard that we do have leaders. We have plenty of people in the movement who do talk about healthcare, whether they're people running for office or they're leaders of organizations or they're everyday people. Storytelling is something that we might all innately recognize, but it doesn't mean we're all very good at it. And in particular, as progressives, we want to tell stories in such a way that it persuades people or it moves them to action in a way that changes the world. So that's what we think is really wrong today, that we don't hear very much storytelling. And when we do, it isn't really compelling. There is a right way to tell stories, and we have been doing this for eons, centuries, millennia. So we're going to take the best of all of that. So here's what we're going to go over. First, we're going to talk about the context of storytelling in terms of the history, sociology, even the biology, like literally what it does to your body. Then we're going to go over the key components, what you need to have in a story to make sure that you're hitting all the right notes. There is a set of things that you must have. And then finally, we'll talk about how we as people tell that story, how we emote, how we stay authentic and true to ourselves, how we connect to people as storytellers. All right, so let's get started. First off, I need to sort of start off by saying storytelling is down to the bones, down to the DNA of human civilization. It is what defines us as a people, as a species. Since I think 30 or 40,000 years ago, we told our first stories through cave art. From there, we actually have the first written story, and we can still tell it now. It's Gilgamesh. And every major leap forward in civilization has been a leap forward in storytelling, whether it's cave art or a written story like Gilgamesh, or the printed word like the printing press, or now today we have technology that helps us disseminate our stories far and wide, from TED Talks to social media to everything else. Stories endure. When we tell stories, they stick in our minds. This is what we tell each other. This is how we transmit information through centuries, through millennia, through civilization, through generations. When your parents may have, put you to bed, they didn't read you a bedtime spreadsheet. They read you a bedtime story. So stories endure. In our social context, they define us as well. From the mythologies that were told in early civilization, the evolution into religion, the fables that we tell to teach morality, all of these are stories. We teach what is right and wrong through story. We even teach who we are to each other, to our children and to their children through stories. Our own family trees, even though they might not be entirely accurate, they give us definition. They help us understand who we are by helping us understand our past. And again, these could be fictions. We might not actually have in real, like really, truly, we might not actually have, relations with royalty or criminals or famous people or the different ethnicities that we thought we grew up with, but we learned later genetically is maybe not true. It doesn't matter, because what matters is we tell these stories because they define who we are, what we believe in. They give us definition around our lives, our society, what's right and what's wrong. And they can move us to action. So in short, stories provide morality and identity. Let's take a look at an example of one of these. Let's do the first one. All right, hit it.
Hi, my name is Laura Packard, and I'm alive today thanks to the Affordable Care Act. Over 2 years ago, I walked into a doctor's office with a nagging cough and walked out with a stage 4 cancer diagnosis.
I meant to get out of bed today and do this video properly, but sometimes chemo gets the best out of you. Obamacare is keeping me alive and can cure my stage 4 cancer, but I need to keep my insurance. I hope you're not sick of my story, because I'm still pretty sick.
I thought my life was over, but thankfully I had good insurance through the Affordable Care Act, and I was able to go through 6 months of chemotherapy and a month of radiation to be in remission, to be here today. I am so grateful that I had good insurance, because it cost hundreds of thousands of dollars to save my life. That's money that I just didn't have. And if I didn't have that insurance, today I would be bankrupt or dead. It's so important to take the time now during open enrollment to go to healthcare.gov and find a plan that works for you and your family. Some states have longer time periods, but nationwide, the deadline is December 15th. So please go to healthcare.gov and see what your options are, because the life you save could be your own.
So that was our very own Laura Packard. That's a powerful story. But in terms of telling that story, there's a lot that I love. And in addition to, this is an important issue and it's an important thing, obviously, for all of us, and it was a piece of Laura's authentic life. There's a lot that she did right in telling this story in a way that appeals to us, that cuts deep. First of all, it was vivid in terms of its imagery. You literally got to see it. But even if you don't have the opportunity to put up a bunch of videos of yourself or of whatever you're illustrating, you can always paint that picture. And the other thing that we loved about this story is that there are critical points in the story where, despite all the hardship, Laura gets to make a choice. And that choice is not always an easy choice, but it's the right thing to do. And what's even better about this story is that she reflects it back into the audience. And that's what's important for us as progressives, as organizers, as people who are building a movement to reform radically our healthcare. We have to make sure that people understand that they have a role to play. In this case, it was something as simple as asking you to go and make sure you enrolled for healthcare or for open enrollment. But it's important that the listener knows that there is something that they too can do in this situation. That's true for us as we organize. Now let's go to one last piece of the context of storytelling, just to really hammer home how powerful and how integral storytelling is to the way that we organize is we can take a look at stories in the biological context. Literally, our brains and blood reflect good storytelling when it's told. So here's a representation of a brain. When you are told information, facts, data, a couple parts of your brain will light up, and they're illustrated here, Wernicke's and Broca's area, and they're responsible for certain kinds of processing. Now, when you're told that same information, but it's wrapped up in a story, like Laura's was, you are lighting up all different kinds, all different parts of your brain. And as those different parts of your brain are lighting up, they're communicating with each other, they're building connections with each other. This is why when we talk about how stories endure, why when we talk about how stories build our identity, how true it is on a biological level. Our brains are always sort of connecting whatever, like our brains are building a far deeper context when we're learning that same information through the story, especially when you make sure that the story has a sensory component, when you make sure the story has an emotional component, when you make sure that story is connecting with the other person, that the other person can see themselves possibly reflected in that story. Then you'll start firing off all different parts of a person's brain, allowing them to remember and to feel what you're saying, and that will connect with the information. Further, when you tell a good story, it literally changes the chemistry of our blood. These are two chemicals that are made in our brain, dopamine and oxytocin. You may be familiar with them. Dopamine is what makes us happy, one of the chemicals that makes us happy. And oxytocin is the bonding chemical. It makes us relate to one another. It makes us care for one another. So these are released during important parts of our lives when we're caring for children, oxytocin, or when we're doing something that makes us happy, dopamine. They're also released when we're being told an important story. And what that does is it allows people, it opens people up. So for example, if you're telling a story where the audience member can relate to the storyteller, when they see the same aspirations usually of the storyteller, they start getting oxytocin released into their brain. And when that happens, it's not simply that they start caring for you, the storyteller. It's that they're more open to believing and trusting what you have to say, which is why we ask you to tell a story prefacing anytime that you're asking somebody for something important. And in fact, there's been study after study that have shown that when you ask somebody for something, an action or even for money, if you tell a story ahead of time, they're far more likely to say yes, and they're far more likely to dig deeper when they can, say, give more money versus less money. So again, we tell stories because we are hardwired to act and believe and behave based on storytelling sort of related information. And I want to make a distinction here because we do tell stories and we do tell anecdotes, but they are a little bit different. So I see an anecdote, my distinction here is that an anecdote is any sort of telling, a happening, which you had for breakfast, a funny little quip or a vignette that happened. A story is something different. It has a structure, it has a flow, it has almost a shape to it. A story has a beginning and an end, it has challenges, it has choices, it has characters, and it has its own sort of pacing. So an anecdote could be just something that happened, but a story has its own shape and structure. So this is maybe the cutest representation I found of what we call a narrative arc. It's literally in the form of an arc. So it begins with you sort of setting a scene. It continues with an inciting incident. In Laura's case, it was her cancer diagnosis. That changed her life and made her go in an entirely different direction. She had to go to a different direction. And then we had rising action. She took action after action, or things happened to her, and it can happen to your characters in your story. And it continues to get more tense. You continue to get more challenges. You continue to get more choices. But upon the climax that happens at a crisis, in a really good story, a story where we are trying to persuade people to change something, maybe their beliefs or their behaviors, we have to have a climax where you get a challenge and a choice. And we'll talk about that in a little bit. And then afterwards, there's a denouement, or whatever you want to call it. The end of the story isn't just the end. The outcome is something more. In a progressive story, when we're trying to make change, the outcome does a couple things for us. It tells us a little bit about our morality. And in an organizer story, there's often a call to action. So let's actually break down the different components, different pieces that I want you to have in each of your stories. And we're going to go pretty quickly through these. These are the 5 that you need: hero, setting, challenge, choice, outcome, and moral. So let's go to the first one, hero. What is the hero in your story? Now, you could have a lot of characters in your story, and we go into depth, but the most important thing is that you have a hero in your story. And that is, we define that as a person first. That might seem obvious, but it's not an idea, it's not a system, it's not an institution. It's a person, and I highly encourage it to be you when it can be. So it's a person, and the thing that is important about this person, the thing that makes the you connect to the audience, the other person, is that it's a person with aspirations. And we're going to keep coming back to that. That person has a drive, has a need that can connect to everybody else's. We tell an example at Convey Communication about another issue area where we talk about immigration. And one of the things that was missing in the story about that a lot of very, good movement leaders would tell that was an error was we talk about kids in cages, kids in cages, kids in cages, kids in cages, and how terrible that is. And for you and me and for a lot of people, that is a big deal. Kids in cages are obviously something to be avoided. That's terrible. It's awful. But there are a lot of people who are maybe not immediately on our side who didn't see themselves in that fight because they don't think of kids in cages. If anything, they think about animals in cages. Instead, what we do to have a good hero in the story is talk about the aspirations, to not shy away from the fact that, yes, it was adults who made a choice to come over, to cross the border, because they made that choice because they have aspirations. They would do anything in the world for their child, anything at all. They would climb mountains and cross rivers, and wouldn't you? Wouldn't you do anything to make sure your child is fed? Wouldn't you do anything to make sure your child has a decent education? And right now, that is what people are doing in crisis. That's the aspiration. The hero to the story doesn't have to be a blameless child. It can be an immigrant who made a choice. So setting the scene, something that's important here is that we want you to engage the senses. Remember that image of a brain and how all those when you're being told a story, the one with all the different parts lit up. Well, a lot of those parts that are lit up are our senses. So if you can't actually have an image out there or video out there, I want you to even more rely on descriptors. We recently had some people do a little assignment where they talked about something they were passionate in, and a bunch of people chose, passionate about cooking. And they all talked about a recipe, or many of them talked about recipes, biscuits, cookies, pizzas, but they didn't use any descriptors. There's so many that are available to you: taste and scent and sight and sound. The other thing that you can do is to make sure that you, when you're setting the scene, you can do a little bit of foreshadowing. You can let the listener understand that things might seem fine, but maybe they're not quite right. That allows you to build tension, and we're going to talk about that too in a second. Here's the thing that is important for our stories. For any story to be interesting, there has to be a challenge. It's kind of the big difference between anecdotes and stories. I can tell you what I had for breakfast, but what if I had to climb a mountain to get it? Now that's interesting, right? Now, any character who's going through a challenge, usually it's that inciting moment, often goes through doubt. We're just not relatable if we don't have doubt. Superman would be boring without kryptonite. So that doubt gives us a little bit of tension too, and that keeps the audience's attention when there is that tension. And for us, as organizers who are trying to change the world into a better world, that there is the tension. It's the world as it ought to be versus the world as it is. And for a lot of us, it's at that inciting moment. Like, things were fine, right? Things are fine. Things are fine. Boom, cancer. Things have to change. And something isn't right about that. So it's not just that cancer was the wrong thing, but it's how we take care of one another in the society when somebody falls ill is atrocious. It's egregious. And that is the thing that has to change. So the challenge here is multifaceted. It's not just the bad thing that's happened to you, but for us as progressive organizers, it's the world that needs to change. And here's the thing that makes us organizers when we tell stories. It's that our heroes have agency. They're not just going through a difficult time, woe is me, and that there is enough woe in the world, believe me. The thing that will distinguish our stories from just things that happen to people is that the hero has a choice to do probably a difficult thing, but it's the right thing. Even if it's the hard thing, it's the right thing. When we tell stories of ourselves or the story of anyone, of the protagonist doing the hard but difficult thing, we are implying to everyone that's listening that they too can do the hard and difficult thing. And in these cases where the hero has to make a choice, where the hero is doubting themselves, where the hero has some challenge, their North Star is their aspiration for something better than what is. And so that's exactly what we're talking about here. For us as a progressive, we can see not only do we want our lives to be better, but we care for one another. And so when we have aspirations, we'll do the difficult thing to make right in the world for ourselves and for everybody. And that's what makes that choice worth making. And that's what leads us to the outcome and the moral of the story. It's not just what happened, but what did we learn throughout the process? It's why we made the difficult choices. It reinforces that, first, that you can change the world. And second, that a better world is possible. Maybe switch those around. A better world is possible, but that you can make that world. You can bring that world about through your choices. And that's why you have to vote. That's why you have to give. That's why you have to sign up for healthcare. That's why you have to call your legislator, whatever it is. It's because a better world is possible, and it is possible through your action. All right, let's do another example. This is a kind of a funky format. It's the slides have to change every 15 seconds. It's called Ignite, and it's actually my story. It's my origin story. All of us are heroes, but all heroes have an origin story. So that is that. So roll it.
Ladies and gentlemen, Arshad Hassan.
Thanks, Adam. My name's Arshad. I work for Democracy for America, DFA. It's a pretty great group. It's progressive. It's political. I'm the executive director. At least I will be until August when I step down. But it's been a great gig. And I know that a lot of you do really great work, but you didn't always. At some point, you learned about right and wrong. You learned about power, who has it, who doesn't. I mean, you're not Lady Gaga. You were not born this way. Somewhere along the way, you learned about you need to make the world a better place. So that means you all have an origin story. This is my origin story. I was born in Grand Forks, North Dakota. In the halls of this school, Red River High School, I learned about right and wrong. More importantly, I learned about power and powerlessness. Now, in high school, I was a huge nerd. I mean, I was a captain of the debate team. I started the chess club, president of the German club. I was mostly just concerned about great grades, and I just wanted to get into a really nice college. One thing I was not in high school was a jock. I particularly hated the hockey jocks. They were on top of the sort of the food chain in North Dakota. It's hockey, you know? They could do no wrong. They were dumb and they were popular, and I kind of just wanted to take them down a notch. So I started a paper, an underground paper, and it was crude, it was snarky. We made fun of those hockey jocks and the cheerleader chicks. I mean, it's a kind of humor you might expect from some 14-year-old boys. But it was popular. And we printed it year after year, and as we matured, so did our paper. We started adding poetry, artwork, satire. We started writing critiques and exposés. We criticized the administration, policies, we named names, and then we named ourselves. One day I wrote a critique of the principal. And I don't actually remember what it was, but I'm sure it was crude. The principal came in and with all of the other administrators marched into the Commons when we were distributing our papers and seized our papers, every last copy. I protested quietly, politely in his office. I said, no, you see, I have the First Amendment right to speak freely. You've made an error. I'll show you you're wrong. And I thought, well, that'll fix it. Once I prove that he's wrong, that'll be fine. He says, no, Arshad, I don't think you understand. I'm the principal here, and you don't have any First Amendment rights. Well, I came to him with research. I had years and years of case law and school policies, and I can show you you're wrong here, here, and here. We're settled. Don't you see? He said, no, Arshad, I don't think you see. I'm the principal. I make the rules. You'll be suspended. And I protested, and he said, Arshad, I understand you're trying to get into some very nice colleges. Wouldn't it be a shame if you couldn't get any letters of recommendation from this school? My world was shattered. How could he do this to me? I didn't do anything wrong, and I knew it. It didn't matter that I was right and he was wrong. It mattered that he was powerful and I was not. So I sat and I thought about it. What do I do next? And I figured if what really mattered was power, it didn't matter if you were right and wrong. What if I could switch the equation around? What if I could be powerful and righteous? Well, I didn't know really how to do that, so I started a petition. So this is the 90s, though. There was no Move On or DFA or Change.org. It was a paper petition, and I had to tell my story person to person, face to face. And as I did, more and more people signed it. We had over 500 signatures in the first day, including those hockey jocks and cheerleader chicks. The school, the real newspaper actually started writing an article. Then Minnesota Public Radio did a little story. Then I wrote an op-ed. Then I started getting those people who were on those petitions to call in to the school and to the principal. Then TV cameras started rolling into my school. Bright lights, lots of attention, all over town. And then from the next town, 70 miles away, it was a media fiasco. We were creating a firestorm of embarrassment for the principal. So they gave me my paper back. I got my paper back, and I came back the next year with my paper. He didn't. He lost his job. Now, of course, the next year I had to start applying to colleges, and they asked me, all these questions, essay questions. They asked me name a time you took a risk, and was it worth it? And so I told them this story, and I couldn't finish the essay because I said, I don't actually know if it was worth it because my principal said by doing this, you wouldn't let me in. Well, I got it. The righteous are not always the powerful, and the powerful are not always so righteous. It's a tension. It's a difficult lesson to learn. But you and I and everyone here in this room, we've learned this lesson. And more than that, we've learned to fight back. And we know that we won't win every time. We know that we won't win actually many times. But we know that if we keep fighting for it, we can finally make the world as it ought to be, not the world as it is now. So thank you, everyone, for doing all of the work that you do.
All right.
There you go.
So that was from back in 2013. I had a different job back then. And it demonstrates a number of the principles that we mentioned were really important. First, there's the hero. Sure, it's me. But that's the easy part to identify. The more important part to identify is the aspirations. In this story, the hero starts with an aspiration that's, get into the good college. But that aspiration changes as he's challenged into something greater, into the ability to speak freely. And not even just that, but the ability to just sort of balance the power here. There's a challenge, obviously, brought on by the principal. That's the suspension, the threats. And then there was a choice made. In this case, it was easy enough for the protagonist of the story to just be quiet and get the grades and get into the school. But instead, the protagonist made a different decision that was difficult and had no idea how to do it or if they would prevail, but did it anyway and won. And that's kind of the outcome, the moral of that story is not just that you should fight, although I'm very clear about that. Yes, you should fight, but that you can bring people together to be more powerful together. And that is how you will prevail. So that and some good media training really does the trick, I suppose. So that's and all of that is told, all of those principles, all of that structure, all of those different components, all done in under 5 minutes. So Alora's story is even shorter than that. It's only a couple minutes. So all of this stuff can be done and should be done in a concise manner.
And once you've got all that down, you've got the least important part down. Because guess what? What counts more than the words when you're telling a story is how you tell your story, your body language, how you use your face, how you use your words. You want to engage your audience, whether it's 1 or 1,000. You want to engage your audience in an interesting way because you need to convince them of something important to you. One thing I want to talk about today that I think is so important is how to color your words and why you want to color your words. Because you can say the same words in different ways and they convey entirely different meanings. For instance, oh, sure. Oh, sure. Oh, sure. Oh, sure. See what I mean? Two simple words, just enunciated a little differently, and they convey incredibly different meanings. So let's start with a little exercise we're all going to do wherever we are across this globe of ours. We're going to try a little exercise and use the word cookies and cream to express an emotion. Now, you might ask why. Well, I don't want you to think about the words that you're saying right now. I want you to think about how you're saying the words. Convey your thought just through the way you color your words. Okay? Let's try the first one. I'm in Florida and I've just escaped Tropical Storm Sally. The weather outside is cookies and cream. What is the weather like at your house? Arshad, what's the weather like at your house today?
Oh, the weather outside is cookies and cream.
Nice. Everybody try it out loud. We can't hear you or see you, so don't feel embarrassed in the slightest bit. The weather outside is cookies and cream. That little puppy is cookies and cream. Mine is begging me for dinner at this precise moment. And that little puppy is a little cookies and cream right now. How about your dog, Arshad?
My little baby boy, Cole, who's almost 11, was being very loud today, and so he's back in my room. But still, he's so cute, and he knows he just used it against because he's such a little cookies and cream.
See how our pets are so different and how we convey to you how they are different. By saying cookies and cream. Sometimes I say wine and cheese when I'm doing this exercise, but today we'll say cookies and cream. It's really important to learn to color your words. For instance, you might say that you're taking a long journey through a field of golden flowers, and the breeze is making the flower petals ripple through the afternoon. Or you might say, while I'm taking this nice stroll through the golden field of yellow flowers, all of a sudden a storm comes up, and it's a big storm, and it starts thundering and lightning and crashing. But then the storm goes away, and the sun comes back out, and it's another beautiful afternoon with a calm wind. Do you see how that got built up, brought back down? We use a pause every once in a while so you can stop and picture in your mind what it is we're talking about and process what we're saying. There's so many ways to color your words. For instance, I'm going to take a quick walk to the grocery store. Or I'm going to take a long stroll on a sunny afternoon. See what I did there? Now, try it one more time at home. Today, my healthcare situation is cookies and cream. Arshad?
Well, today my healthcare situation is cookies and cream.
Good. So what we're talking about is coloring your words and really thinking about how you are presenting your story. You want to connect with people. I mean, we could go on and on for hours about, eye contact and body language, and we would if they gave us the time. But we don't have that time today. So think about coloring your words. Just think about making your story more magical, making your story more interesting, making your story more meaningful, and how you can connect your aspirations with the aspirations of those who you're telling the story. So that is the main thing. You could just take out your crayons, you can underline, you can bold, you can highlight, do all those things, and think about that when you're constructing your story. That's all part of the story, because you want to be interesting, engaging, and convincing. Right, Arshad? Do you have anything to add to those?
Sure. I love what you said about take out your crayons, because I think a lot of people focus on speech writing, like that's the big thing. Oh, I have to write my speech. But we think about it more like speech choreography. The words are one thing, but you also have to give yourself direction. What is the emotion you want to convey here? Where is the pause useful there? So I think it's not enough to write your speech. That's the least that you can do. I think what you need to do is choreograph. Anytime that you're in the media, when you're giving a speech, when things return to, us being in public and speaking again, we advise the same thing to all of our clients. The words are one little thing, but really what we want to see is emotion. We want to color your words. We want to get your choreography set. Really, truly, take out your crayons or colored markers and color your words.
Yeah, imagine if you're watching a play or a movie and the actors are just reading the script. I mean, they're being authentic when they're being great actors. Don't get me wrong. And you can be too, because you're not being fake. You're being very intentional about conveying your message. And we want you to shine when you tell your story. We want you to be the best storyteller you can be, because the work you're doing is so, so important.
Ooh, I do have one more thing for that, Vicki. So I didn't go into it when I was thinking about it, but the story that I told, the 5-minute story I told, I had to reduce it to 5 minutes because the time limit. And I'm really glad I did, because that story, when I used to tell it, was 20 minutes long. There's a lot of extra detail in there. It's a super fun story. But honestly, the most important parts all fit within 5 minutes. So our tip with you, with all of you who are telling your healthcare story, tell your story, write it out, do the things, like I know you want to stress about like writing a thing out. Again, although that's kind of the least important part, because we don't even want you to have written words in front of you. But once you write it out and speak it, we would say perform it, then take it and cut it in half. Cut half of it out. So if it's 10 minutes, now it's 5 minutes. This is a very important exercise, because it's important to be concise. And then once it's 5 minutes, now you want it to be 2.5 minutes. Particularly as the media starts taking an interest in what you're doing, those sound bites are 9 seconds. So you want to be able to have the practice of being powerful, of connecting to aspirations, being emotional, but also being concise and all of that. So this is an exercise. Even your stories have to be concise. Actually, I would say especially your stories have to be concise.
There's a technique in doing this too that our mentor, Joel Silverman, taught us. And that is to record your speech, then transcribe it, because it won't be exactly as you wrote it. Transcribe it, take out half. Take out the chaff. Do it again, take out half again. But record yourself and make adjustments as necessary. I know it's kind of weird, but it will be so, so helpful to you to do that. Yep. And there's a couple of tips we've just thrown in there. So thank you, everybody. If you have any questions or comments or need to get a hold of us, there is 10,000 ways to reach us right now. We are so grateful to be here with you all this afternoon, and good luck to everyone. Laura, take it away.
Thank you very much. So next up, I'm thrilled to introduce Linda from Social Security Works to talk about how to share your story with others through the written word, writing letters to the editor.
Hello. As Laura said, my name is Linda Benish, and I am Communications Director at Social Security Works, which is a national nonprofit focused on protecting and expanding Social Security, improving Medicare, and lowering prescription drug prices. I've been working at Social Security Works since 2013, and in that time, I've had the opportunity to write, edit, and place quite a few letters to the editor, and I'm excited to share with you all some of what I've learned in that time. Next slide, please. Thank you. So before you even start writing your letter to the editor, there's a few important questions that you want to ask yourself. The first one is, what is the topic that you want to write about? When you differentiate the good letters to the editor from the bad ones, this is always the biggest difference. Somebody who writes like a long laundry list of every grievance that they have in the world, they're not going to write a very good letter to the editor. Somebody who sits down and knows exactly what it is that they want to change in the world with their letter, that's the foundations of a good one. Next thing, what is your news hook going to be? Can you go back to the previous slide? Thank you. So next question, what is your news hook going to be? Right, so that can be either a story that's in the news, so it can be a Supreme Court case, it can be an election that's coming up, maybe a ballot initiative, say on Medicaid expansion. It can be a new study that comes out, but it should be something that the media is likely to cover. Next, who is your audience going to be? So there's a few potential audiences for letters to the editor, and it's good to have one in mind when you're writing. One is, of course, voters. There's a lot of overlap between people who vote in every election and people who read the opinion section of their local paper. Another big audience is politicians, whether that's members of Congress or more local lawmakers. And if you want to be sure that a certain politician reads your letter, what you want to do is mention them. Because believe me, either they're checking out their Google alerts or they have a staffer who does. And finally, members of the media are generally reading letters to the editor, whether that's reporters for the paper that you're writing in or your local TV journalist. So if you want to shape the way that the media is covering an issue, writing in LTE is a great way to do it. And then lastly, even before you start writing, you want to have an idea of your top outlet that you're going to submit the piece to. And this is because different papers will often be looking for very different things, both in terms of the word limit, like some of them will give you up to 300 words, some of them will cap you at 150, but also in terms of whether they only want letters that are a direct response to an article that's written in the paper, or whether they're fine with something that is just your own idea. Next slide, please. So now you've asked your questions and you're ready to start writing. So you want to start out right off the bat by engaging your audience. And in doing that, you want to both get the news hook and your story in within the first 2 sentences. So say you're talking about an upcoming initiative on Medicaid expansion. You say, lean into your identities that people relate to. So say like, I'm a mom or I'm a teacher, right? And this is how passing this initiative would impact me and my family. You tie in your story, then you state the problem, you broaden it out, you talk about how many other people in your state or in your county would be impacted by this as well. This is a good place to throw in one good statistic. I definitely don't recommend using a lot of statistics in your letter. As Vicki and Arshad talked about, it's really the story that hits people the most, and you certainly need to bring in your story before you get to a statistic, but good rule of thumb is 1 per letter, and if it's a local statistic, something just to do with your state, or so much the better. And then you inform on the solution, so explain more about, say, how like Medicaid expansion or casting a certain vote would help you and your family and everybody in the state. And then finally, you end with a call to action, whether that's to get out and vote. It can be to call a certain politician and tell them to vote away on upcoming legislation, and this is a good place to mention them. But you want to make sure that you leave your readers with something concrete that they can do to address the issue. Next slide, please. So now you've written your LTE and you're ready to submit. So you want to locate the submission requirements on the website of the paper that you're going for. And these can be in a few different places depending on the site. Good places to look are the opinion section itself, the About Us section, or the Contact Us section. And then in some cases, they'll have a submission form for letters. And this is actually quite useful because it'll tell you exactly what they want, which will often include your phone number, your email, and any organizational affiliations that you might have. But if not, and they just have an email, then you try to include most of that information, but also don't stress about it too much, because anything that you don't include right off the bat, they can always ask you for it later. I do recommend only submitting to one paper at a time, and how much time you want to give each paper to respond just depends a lot on your news hook and how time sensitive it is, right? If you're writing about a Medicaid expansion initiative that's coming up in a couple of days, you don't really want to give them too long. And in general, I don't give most places more than 48 hours to respond. Sometimes you want to do even less. But I do recommend following up with 1 or 2 emails, and in the last email, you give them a specific deadline. Say, since this is a time-sensitive topic, I'm going to submit my letter elsewhere if I haven't heard back from you by X time. And this follow-up is a great way to make sure that you get at the top of your inbox more than once. Now, one other important thing I would say about letters to the editors is that Laura is going to be talking shortly about how to get plugged in with your local activist groups. And I really do recommend reaching out to them at every stage of this process, right? Whether it's when you're writing, when you're trying to decide where to submit, and when you're actually submitting, because the leaders of these groups, they'll often have relationships already with the op-ed editors. They can also help you with editing, and we're all really stronger when we ask for help, so never feel embarrassed to. Next slide. So I want to leave you with a few additional resources. Indivisible has a great page on their website that's focused specifically on how to write letters to the editor to get the attention of your members of Congress. So if that's what you have in mind, I highly recommend checking it out. And then the Op-Ed Project is a great organization that runs a lot of all-day trainings on primarily on writing op-eds, but so much of their advice about opinion writing is just as applicable for letters to the editor. And they also have other good resources on their site, including submission information for a lot of publications. And finally, if you have any questions about any of this, please feel free to contact me at lbenish@socialsecurityworks.org. And with that, I'll throw it back to Laura.
Thank you. So let me just remind people, if you sign up for our email list, the bit.ly link is showing up periodically. We'll be able to send you these slides afterwards if you want the slides. And also, this training will be available via Facebook and via YouTube anytime you want to watch it again. So let's start talking about how you share your story via social media. Go ahead and put up the slides. So the first thing to think about is, what's your goal? What do you want to accomplish by sharing your story? And are you okay if this story spreads? And are you okay if it doesn't? There may be personal or professional repercussions, or just if you're sharing something personal and it doesn't get out there as widely as you like, that's incredibly demoralizing. So remember that whether something goes viral is not a judgment on you. And the more your story spreads, the more negative responses you'll get. And that is just a fact of life. Don't read the comments. And if people are mean, remember, they might be Russian robots at home in their basement eating Cheetos in their virtual underwear. So try not to take it too personally. But I understand that's hard to do when you're sharing something so personal. The next thing to consider is, are you telling your story via text or audio or video? What format suits your story, and what are you comfortable with? Video can be compelling, but if the essence of your story can be boiled down into a few sentences and it ties into current events, it can go viral on Twitter with text alone. The tweet here on this slide was very topical. The House was voting on the Affordable Care Act repeal and did vote the next day. And that tweet reached 1.2 million people according to Twitter analytics. And there is no video or audio. It's just boiling down the essence of my story and what I'm asking them to do in just a couple sentences. Something else to consider is, which platforms do you already have an audience on? Do you already have a bunch of social media friends on Facebook, for example? And if you share your story, they'll help spread it. If you don't have a built-in audience, are there groups you can work with to share your story? And I'll talk more about that in a little bit. Or is there something in the news that you're reacting to? And if you use popular hashtags on Twitter and Instagram, etc., it'll reach a much larger audience right now. Ask for help, and don't assume people have already seen your content just because you posted it. Because social media platforms are so ephemeral, if you post something, you cannot assume that people will have seen it, because in a few minutes, something else comes along. So reach out now in your state to others who work on healthcare issues and build these kinds of relationships before you really need to use them. And then when you put something out there, feel free to nudge people to share it for you. This is slightly less weird to do on Twitter than Facebook, perhaps. And use hashtags. Tag people and organizations, if appropriate, with your content to help them see it and hopefully to spread it. You can always use evergreen hashtags like Protect Our Care and so on that people are already using about healthcare. But new hashtags pop up all the time as new events happen. But usually it's not as simple as just posting something and walking away. It takes some work to get others to amplify it and really help your message spread. And speaking of examples, lots of people shared their stories during the healthcare fights of 2017. Most notably, people like Adi Barkan and several of my friends in key states. And we're seeing new people come forward now that are telling their COVID stories, like Kristen, who spoke at the Democratic National Convention about her dad's death. So there's always room for a well-told story at a time when it's most relevant. And if you'd like more examples, my Twitter account is at @LPackard, where I highlight a lot of other healthcare stories around the country. And finally, let's talk about how to get involved nationally as well as locally. First thing you might want to consider is that the most impact you can make is usually on the local level. Whether you're in a red state, blue state, or swing state, there's usually healthcare legislation happening locally as well as federal legislation. And you and your personal experience can help make or break legislation in your city or state that could affect you directly. Depending on what happens this year, there may be a lot of opportunities next year to pass national legislation on healthcare reform, on drug pricing reform, and more. And all of these groups will need people like you that are willing to share your stories next year. And on the slide, I list a few different groups, including Healthcare Voices, my own, but Healthcare Voter, Hero Action, Little Lobbyists, Protect Our Care, Families USA, Social Security Works, I didn't put this on there, but I should have, ACA Consumer Advocacy, Lower Drug Prices Now Coalition, and many more. So whatever aspect of healthcare that you're interested in, there may be a national group already working on that you can work with. And also, like I mentioned before, on a local level, you can really make a difference. So figure out what groups in your state focus on local and national healthcare issues. For example, here in Colorado, there's a great group called CCHI, Colorado Consumer Health Initiative, and they work on lots of different pieces of legislation having to do with healthcare. Through them, I testified to the legislature this year in favor of a Colorado public option, and they also passed a reinsurance bill to lower premiums for people that get their insurance across the state. Other opportunities include their insulin and drug pricing transparency bills in several states, and there are efforts to stop surprise medical bills in several states as well, since there is not a national solution yet. And for the 12 states that haven't expanded Medicaid yet, see if there's a coalition in your state working on this. And if there isn't, you could try and start one. The Fairness Project is working with lots of state-based groups on Medicaid expansion, so that's where to start there. And there's also multi-issue groups in the states, like Progress Now has several state chapters that work on many issues, including healthcare, and they're great to reach out to as well. And once you find a group and you like their work, you can reach out via phone call or email, and you will probably get a better response the more local you go. If you try to contact somebody at a national group, they may not check his email as often, or they may not respond to voicemails, especially these days with people working from home and offices aren't necessarily open. So be patient. And if you start telling your story now and it starts getting out, don't be surprised if groups don't start knocking on your door, figuratively, to ask you to work with them too. And one final thing, you are more than your story. Thank you for being willing to share your story, but remember that your voice has value and your ideas have importance above and beyond what you may have experienced. I hope you don't ever feel pigeonholed by what you've gone through, but use it to get to where you want to go. And thank you again to all the presenters that shared their wisdom with us today. Again, if you sign up on the bit.ly link, we'll be able to send you a follow-up, including access to the slides. And also, these slides, the whole presentation will be available on Facebook and YouTube going forward. So if there's something you want to see again or share it, please do. Any last words from my fellow presenters?
I'm so excited to hear some of these healthcare stories. Thank you so much for this opportunity.
Yes, me too. And to see how they're presented as well. Thank you all so much. And really, best of luck to you all.
Thank you so much to everyone.
Thank you.